Hi everyone, hope you can hear me okay. I'm Keith Scott. I'm the head of data management at Myeloma UK. And yeah, I'm going to take you through a little whistle-stop tour of all the things that we did with our assessment. So
Sorry, Keith, you're muted.
hi, can you hear me now?
Yeah, you're back.
Great, okay. Yeah, so a little bit about us. I'm Keith Scott. I'm the head of data management at Myeloma UK. We are a blood cancer charity, and I've put some stats there. I know that as data audiences like some stats. So there's 24,000 myeloma patients in the UK. It's the 19th most common cancer, and yeah, it's the third most common type of blood cancer. And we are an organisation exclusively dedicated to the disease and the related conditions. We employ about 100 staff, and sort of uncommonly, we're headquartered in Edinburgh. Rather than down south, but a lot of our staff are actually spread out across the UK, working remotely. And yeah, our data team within that 100 staff is small but mighty. We're three people, including me. And yeah, we've got I think Ray is actually on the call today as well. He's part of the team. So hi Ray. Um, let's see if I can get this. So why did we decide to do an assessment? So I was quite new in the role. And I was trying to figure out how we could get some kind of baseline to measure from. And I knew I had a data strategy to write and present to boards sort of this year. And we did that back in February, and the strategy was meant to go to board in May. And I just thought when I found the framework, it looked like a really good foundation to kind of establish a clear baseline. It was so holistic, as Shyam was saying, so it seemed like a really good way to kind of I guess, present a really complex thing to possibly board members that might not be technical, a way to kind of come to a measure that we could, yeah, have a baseline and then improve from. I came from higher education and I was so used to having so much benchmarking data about expenditure and staff and what people were doing and where the money was coming from. And I was kind of missing that a little bit in the third sector. So the benchmarking element was quite, yeah, that was quite a good kind of temptation as well. And we'd done some internal workshops in the charity with some consultants called Data for Action that were really good. And we'd kind of validated some questions that we had around our work that we couldn't really answer easily at the time with kind of how we were collecting data, maybe the questions we were asking, and I guess just the tools and things that we were using too. So that was quite a good kind of North Star a little bit and thinking about alongside these assessments is to think about yeah, where do we want to go and what would good look like for us? We had a huge, big, long list of to do. So there was lots of things in the charity that people wanted to fix. There was pain points for various teams. But having the results of an assessment, I thought would really be helpful to us to prioritize because obviously you can't do it all at once. So it was good for us to kind of focus down on that. We also had a really established internal data working group, which was great because they're really engaged colleagues. They really know the data within their own little functions. That really gave me some confidence that we would have a head start on some of this work too. So that was great. See, I thought I'd just sort of see what was involved. So we chose the bronze level at the time. We didn't have like a huge big kind of budget or anything to do this work, but the bronze level was actually quite a good level for us at the time. We chose to do an online workshop with staff, which was great because it really was quite helpful just to kind of set the scene. And as I was saying, just like, what do we mean by data? What's covered here? What perspective should you think about when you're answering these questions? And there was some really valuable analysis afterwards about the just sort of breakout workshop discussions around some of the themes and people's comments and their kind of their sentiments around stuff. So that was really useful when writing the strategy afterwards too. We got really good participation. We got some really good buy-in from the leadership team and the CEO and things. We did need to chase up quite a bit afterwards to try and get up to that 92%. I think we were probably more like 60 or 70 attending on the day and then did quite a lot of chasing afterwards for those that couldn't attend. The data working group really helpful again in trying to kind of chase people and get that buy-in and push up responses because we were really it was important to us to get representation from all across the charity. There's so many different teams delivering services and sort of more operational core support, and then obviously the fundraiser. So we really wanted to make sure that the evidence we were basing our plan on was representative and might be effective. So yeah, this was kind of a little slide that kind of shows you our results, and we were pretty good on things like uses, like above benchmarks for that. Leadership was quite a nice one to see that people thought we had quite good leadership around data, but we were not so good on culture, on skills, and on analysis. And we also did a little qualitative question in our survey just to try and get people's sentiment about how they felt about data. And you can see there was some kind of things in there about, oh, it's a bit clunky, we need improvement. People were worried about things like security, but there was some quite hopeful words in there as well around things are getting better and there's improvement and we have some hope there. So yeah, as you can see, we did score lowest in those three areas, but that really helped me to then shape what I was going to put into the strategy to board. So those became our focus areas, and having that analysis on the workshop stuff was really useful for that too. The board approved it in May, and we've done some kind of staff-wide sort of presentations and comms around both the assessment and what was in the strategy and kind of get roadmaps for teams. And yeah, really focusing on the key themes that came out of those assessments as part of that. And yeah, our work plan for the coming year. Ray, that's on this call, has been really helping me to do some surveys around the charity around what do teams need for their data skills training. So we've got a training program developed for that that are based on what people have told us there. And we're developing a policy around data governance and trying to get things like data glossaries and really agreeing on terms and what we mean by data and what we want to do with it. We have lots of data visualization projects around that analysis theme. We have some really good dashboards now on some of our service sort of things that we want to measure. We're using Power BI and Fabric semantic models for that. And we've got lots of further projects underway for next year, especially around data accessibility on some of our income generation stuff, acquisition, retention on various programs. And we are looking at impact measurement as well, trying to introduce a framework for collecting evidence against the strategic outcomes for the whole charity. So that'll be quite a big focus of our work too. But all of the next steps that we have are pretty linked to both the things that we did when we were looking at questions we couldn't answer and trying to get to the like, can we answer those questions? And also using the evidence that we'd had from the maturity assessments to really say, we have quite a good evidence base that these are things that people feel like we should be fixing or at least trying to get better at. So yeah, it was really useful for us to have that. And that's me. Thank you very much.